Have you ever really stopped to wonder what's going on inside a nurse's head? I mean, beyond all the tasks we see, the vital signs, the medications, there is this constant, high-stakes mental process happening. It's this sort of invisible work that literally saves lives every single day. So today, we're going to pull back the curtain on the incredibly complex, structured thinking that powers the entire nursing profession.
It's such a great question, right? Because it's not just about what they need to do, it's about what they're observing, what they're connecting, and what they're anticipating. They're basically detectives, analysts, and strategists all rolled into one, and that whole process kicks off the second they step through that door.
So let me paint you a picture. Imagine a newly graduated nurse. She's in a critical care unit. One of her patients, who's being treated for heart failure, suddenly starts showing some irregular heartbeats on the monitor. The stakes? They're incredibly high. A decision needs to be made, and fast.
Now this is the really cool part. The nurse doesn't just see a symptom on a screen. Her mind immediately starts connecting the dots. She remembers the patient is on a high dose of diuretics, and then this critical piece of knowledge just clicks into place. Some of those diuretics can cause a huge drop in potassium, and that can seriously mess with the heart's rhythm.
So she quickly pulls up the patient's chart, and boom, there it is. The one clue that confirms her whole hypothesis. The patient's potassium level is critically low. See, she didn't just stumble on this. She actively hunted for it because of her thought process. That one mental leap probably prevented a full-blown cardiac arrest.
And that's exactly what this is. It's a life-saving catch. This isn't some lucky guess, you know? It's the product of a very specific skill called clinical judgment. And honestly, it's one of the most critical skills any nurse can have.
The ability to look at a patient, recognize these really subtle cues, and make these kinds of connections, that is at the absolute core of modern nursing. It's a deliberate process that turns bits of information into life-saving action.
So you might be wondering, how is this way of thinking actually taught and structured? Well, for decades, nursing has relied on this foundational model. You can think of it as a kind of classic playbook that's guided generations of nurses.
It's called the nursing process, and most people remember it by the acronym ADP. For a long time, this 5-step circular model has been the roadmap for how nurses think and provide care. It's systematic and it's super reliable.
Let's break it down really quick. It starts with assessment. That's just gathering all the data. Then you've got diagnosis, figuring out the patient's problems. From there, it's on to planning and setting goals. Next up is implementation, actually taking action. And finally, evaluation, where they check the results and, if they have to, they start the whole cycle over again. It's a really logical and effective framework.
But you know, as healthcare has gotten way more complex, the thinking behind nursing has had to evolve too. A new model has come along, not to replace that classic playbook, but to build on top of it, adding this new layer of detail that's perfect for today's crazy healthcare world.
And here it is, the Clinical Judgment Measurement Model, or CJMM for short. It was developed specifically to teach and measure the complex decision-making skills that today's nurses need right from day one. It's really a direct response to the fact that nurses are now managing way more data and much more complex patient needs than ever before.
Okay, so here's the crucial difference. Think of it this way. If the classic ADPI process tells nurses what to do, the CJMM digs a lot deeper and explains how they're supposed to think through each of those steps. It really breaks down the cognitive skills they're using to make a good clinical judgment. Honestly, the best way to get a handle on this new model is just to see it in action. So let's walk through a case study together, step by step, and watch how a nurse uses this framework to solve a patient's case, almost like a medical detective.
All right, so this table right here lays out the 6 core cognitive skills of the CJMM, and this is going to be our roadmap. We'll start by recognizing cues, then we'll analyze those cues, prioritize hypotheses, generate solutions, take action, and finally, evaluate the outcomes.
So let's meet our patient. This is Mr. Silva. He's 3 days out from a knee replacement surgery. Now, on the surface, everything seems to be going just fine, but a great nurse's job is always to look beneath the surface.
And here we go. Step 1, recognize cues. During a totally routine assessment, the nurse notices the surgical incision is a little red and warm. Now, these aren't just random observations. In the context of a recent surgery, these are critical cues, the very first clues that something might be off.
So what happens next? Step 2, analyze cues. The nurse doesn't just write down red and warm. They analyze those cues and figure out what they mean. And this isn't part of normal healing. These are the classic hallmark signs of a potential infection.
Which brings us to step 3, prioritize hypotheses. Look, the nurse might have a bunch of things to do for Mr. Silva, right? Maybe update his diet plan, but the hypothesis of an infection, that is way more important. If you leave that untreated, it could become life-threatening. So that shoots right to the top of the priority list.
On to step 4, generate solutions. Based on that top priority problem, the nurse plans her actions. The plan is simple. Let the provider know, because she's probably going to need an order for antibiotics, and then get ready to change that wound dressing. These solutions are all tied to clear, measurable goals, like reducing the signs of infection within a day or 2.
And step 5 is where the plan becomes reality. Take action. The provider confirms the infection, prescribes the antibiotics, and the nurse gives the medication and does the wound care, just like she planned. This is the direct intervention designed to solve the problem.
And here's the key. The process doesn't stop there. We have step 6, evaluate outcomes. The nurse is constantly monitoring Mr. Silva's incision, checking to see if the redness and warmth are going down. Is the plan actually working? If it's not, the whole cycle just starts right back up again. It's this continuous loop of thinking, acting, and reassessing.
So let's zoom out for a second. Why are these structured models so incredibly important? Why does this level of detailed clinical judgment really truly matter out there in the real world?
Well, it's because this kind of structured thinking is so much more than a simple checklist. It's a whole system designed to promote quality care, improve patient safety by catching and reducing errors, and at the end of the day, create much better outcomes for patients just like Mr. Silva. It is truly a framework for success.
So the next time you see a nurse, I really hope you'll see more than just the tasks they're doing. I hope you'll see that constant churn of analysis, prioritization, and problem-solving that's happening just beneath the surface. You'll see the invisible work of a mind that is trained to save lives. And that is something truly worth recognizing.